Hey, hello everybody. I'm Lisa. I'm the Director of Community Relations at Natural Medicine and Rehabilitation, and we are located in Somerset, New Jersey, and I'd like to welcome you all to our nutrition webinar today. As part of our community relations, we offer programs such as this one to help support our mission and give back to our community. This year, we are so excited to be celebrating our 25-year anniversary, and our mission has always been the same: to help educate our community on preventative health care, empower people with information to live healthier lives, and preserve their quality of life for years to come. Natural Medicine and Rehabilitation is a family-owned, holistic healthcare facility providing functional medicine, nutrition, weight management, and hormone replacement therapy, physical and occupational therapy, chiropractic care, acupuncture, women's health, blood work, and services for tempering stress. Today's nutrition webinar will be presented by our founder and clinic director. He is board certified in chiropractic medicine and chiropractic neurology. He is a clinical nutritionist and a certified strength and conditioning specialist. At this time, I'd like to introduce you to Dr. Sferra and turn the presentation over to him.
Thank you, Lisa, and welcome everyone. It's a pleasure to, I guess you could say, be in front of everybody. If you notice on the last slide on the little bio on myself, it said the passion to uncover the root causes of disease. And I specifically put causes in plural because it's very, very rare that any health condition or even a dysfunction in the body is being caused by by one cause, and that it's multifactorial almost all of the time. And kind of therein lies why we need to consult and do testing and be involved with clinical professionals who have experience in putting these things together to really look at a comprehensive level of their lifestyle and how it impacts their disease, their dysfunction, and restoring their health. But today specifically, we're going to talk about micronutrients and as well food sensitivities. And on this slide, you're seeing we're going to cover things like what micronutrients are, what food sensitivities are, and how they can be involved in disrupting your absorption of the nutrients that you get from your food, the role of the micronutrients, how we test these things, who can benefit from it, and so forth. So micronutrients are found in small amounts in all the food that we eat. Now, unfortunately, it's not just the food that you pick up off the shelf or in the produce area that matters, but also what matters how these crops were harvested, the shelf life, how we cook them and prepare them, how we go ahead and eat them and digest them and so forth before they actually are able to get into our body and be of benefit to us. But on the slide, we see a summary of what the micronutrients are. They're vitamins, minerals, cofactors, which are things that help support the reactions in our body, in our physiology, in our biochemistry to utilize vitamins, minerals, and our other foodstuffs. Amino acids, which are the smallest breakdown of proteins, metabolites, antioxidants, which are very important, particularly in this day and age where there's so much oxidative stress and burden in our body from chemical exposure and toxins in our world. Essential fatty acids, which are the smallest components of the healthy fats. And we need to get optimal amounts of all of these, which is unfortunately very rare that across the board, everything is done, is consumed and absorbed in an optimal amount. But the micronutrients are vital for metabolism, growth, and physical well-being. The role, they build energy. They help our immune system. They support reducing inflammation and free radical protection, which again is part of protecting our bodies from stress, from the physical effects of stress. Along with that, cancer prevention. Insulin sensitivity has a lot to do with our blood sugar control, which I will say it is probably the top 3 areas that we mismanage with our lifestyle and diet that create a lot of the problems with our health. With anti-aging, we're going to learn that micronutrients are important for us to age well, and as we age, there's a natural tendency to have inadequate intake, less efficient digestion of our micronutrients. We get more accumulation of toxins as we get older just because of time, And that gets in the way of micronutrient balance. And our digestive capacities start to become limited, if you will, as we go through our years, even naturally. And then for some of us, we've done damage to compound the effect, the adverse effect of the digestive capacity. So clearly it's important that our micronutrient status is good, but not just what we're consuming, but what we get absorbed and actually gets into our tissues. Okay. So this slide here depicts the biochemical processes of inflammation, of energy production and recycling of energy in the cell. I'll leave it up for an extra 30 seconds for you guys to absorb it. No pun intended there, or maybe there was a pun intended, but all kidding aside, I don't expect learners, but it is actually a abbreviated or shortened version of the biochemical pathways in our cell to create energy. Clearly, it's complex, and micronutrients are at the foundation of building this energy and recycling the energy in our cell and the mitochondria, which are the powerhouse of our cells. Just to impress upon you the intensity and the complexity of that process. Getting down to maybe a little bit more down to earth with things, I want to, before we get into testing for micronutrients and food sensitivities, I want to talk a little about some concepts of health that I believe are very important, share and educate you a little bit on that. Natural medicine was founded 25 years ago. I've been in practice going on 38 years now, but 25 years ago, we started natural medicine, and it was built upon a foundation of a triad of health, which is you are what you eat, think, and do. We've heard of you are what you eat, but it's actually more than that. It's everything that comprises you that you experience. It's called the exposome. And this slide depicts the triad of health: mental outlook, nutritional habits, and reconditioning exercise. And we can expound upon that even further. Let's say on the mental side, it'd be the mental, emotional, and spiritual part of health and your persona. In the nutritional, it's really the combination of, or the accumulation of all things that we expose our bodies to, not just the nutrition, but what we consume as far as fluids, what we're exposing our bodies to with toxicity, whether that's alcohol, other medications, whether they are prescription or not, pollution, so forth, what our body gets exposed to on a physical and biochemical basis. And then the bottom side of this triangle, reconditioning exercises, which goes into how we're using our body. Are we couch potatoes? Are we just doing normal daily activities? It's not uncommon for me to do consultations, and we get into what people are doing for exercise and moving their bodies, and they say, well, I'm very active, I use the stairs, and I don't sit at work, and I like that, but sorry to say that doesn't cut it when it comes to reaping the benefits from exercise. Most of us that don't have physical jobs need to program in time for exercise. So we talk about that, and that's a third of the triad of health, how we're using our body and conditioning our body. It's very, very important. I love this comment by Dr. Jared Zeff, 25 or so years ago. The work of the naturopathic process-oriented physician is to elicit health by helping patients to create or recreate conditions for health to exist within them. And these last two sentences, I think, are at the foundation of everything a functional medicine doctor is looking to do for their patient. Health will occur where the conditions for health exist. Disease is the product of conditions which allow for it. So in essence, it's the terrain of our body that we have to take care of. And if we are doing a poor job with that, we invite dysfunction and disease. Okay? If we turn it around and start putting the right things to our body, start reducing inflammation, treating it properly, we start to create conditions that allow for health to occur. And it's a profound thing, as simple as it may seem on the slide, for us to become involved with for our health and for the health of our families. So along with that terrain and the conditions, I want to continue to educate and talk about this thing called the microbiome. Some of you just may know it as the bacteria in your gut. People take probiotics and hoping that's the answer, and sometimes it helps some, but in general, it's more than that. It's not a bad idea, but it's more than that in regards to taking care of the microbiome, and that is the balance of that ecology of gut bacteria and all the other organisms that are in there, viruses and so forth, as opposed to having those being more detrimental and pathologic, if you will. We want them to be healthy. So we have to treat that environment well, and that is all about lifestyle, nutrition, and exercise, believe it or not, and doing some of the right things for ourselves in that regard. Now, for those of you who are unaware of it, this is not just a new idea. If you were to go on to PubMed, which is the National Institutes of Health library for medicine and science, you'll find close to 75,000 peer-reviewed articles on the microbiome and its relationship to health. So this is not only nothing new, it is quite extensively researched, and we know it to be a key factor in all things health related. And so much so that I just wanted to putting up here, I don't know whether it was on there 15 or 20 different journal articles, or covers, I should say, about the microbiome. But again, 75,000 or so peer-reviewed ones, and that's not to mention all the other articles that we can probably find that are just laypersons or scientific writers deciding to write about the microbiome. It's important for us to take care of that. And we'll talk a little bit more about some of the things we can do for that. And it's, as you can guess, it's going to revolve around food sensitivities and the micronutrient status of our body. Some more things to share with you. Factors that lower BMR, stands for basal metabolic rate, and we can equate this to factors that lower our body's overall health quotient, if you will, by fasting, by having too much fat on our body or increase in fat mass, by being malnourished or having nutrient deficiencies. And I'll say nutrient deficiencies / insufficiencies, because that's very important too. A lot of times you go to a regular doctor, they'll test with your blood, they'll test your magnesium level or different things, not many. Sometimes I'll see a couple of them come up, but they're testing serum. And as long as you're in this very thick range, you're okay. But we can have a situation where you're in range, so you're not deficient, but you are certainly insufficient in your body's amount of that specific nutrient. In the functional medicine world, we like to have a tighter rein on those ranges because we want them to be optimal, not just barely enough to stay out of the deficiency range. Things like chronic stress will lower our basal metabolic rate, as opposed to acute stress, which would actually increase it. If you were frightened and had to fend for your life, your metabolic rate would go up. Chronic stress is the one that we mostly talk about when we're stressed, actually reduces our metabolic rate and our metabolic efficiency. Toxicity, we'll mention that. And then thyroid, very important. Thyroid sits in deep in your neck, from your throat, and is important for metabolic rate and metabolic repair. So we're big on testing the thyroid and the antibodies to the thyroid to make sure that we're doing well in that area. Oxidative stress. I wanted to list the things that we could be doing that create greater toxicity, hence create a problem for the body to really absorb and utilize these micronutrients, actually get them into the cells of the body. Okay? Even if we're consuming great nutrition, we have to make sure we digest and get it into the body. And then once it's into the body, it has to travel through the blood and get into the cells, these micronutrients do. Oxidative stress has its way of getting in the way of that. And so we have a nice list here of some of these things. You know, it's not uncommon for patients to want to know what vitamins to take, what am I deficient in? And in the meantime, they're using too much alcohol, their diet's poor, and they have a number of these oxidative stress markers going on in their life, so to speak. They have to be handled first. And as well, and maybe more direct, is the eating styles that result in nutritional insufficiencies, thus not allowing for micronutrients to get into our body, either from not being in the foods themselves or creating disruption in digestion, and absorption not allowing those foods to get in, those foodstuffs or those micronutrients. So if it's fast food, processed food, prepared foods, too much sugar and starches, bad, unhealthy fats from fried foods and fast food, not eating enough fibers, vegetation, that include fruits as well, where we're getting a lot of those micronutrients. Beverages that are unhealthy, high sugar or high artificial sweeteners, very toxic, and just habits that perpetuate poor digestion, eating on the run, gulping and going, things like this, being emotionally upset as you're trying to chow down some food, all these things get in the way of digestion. So there's some more ideas and food for thought for yourself as you're wondering and concerned about your micronutrient status and what vitamins do I need. Are we handling these things? Because without this, we could take vitamins and we can do some things, but it's not going to be good enough. We have to make sure that lifestyle is in the ballpark of creating conditions for health. Just another slide here on what some of the things are that adversely influence absorption of micronutrients. Sometimes it's genetics, the genetic tendencies that can be a factor. Generally, not something that we deal with typically in practice, but certainly some of these others, different medical conditions. There could be problems with the gut permeability or the gut barrier that's been breached. There could be problems with autoimmunity in the gut, such as celiac disease. You could just simply have a poor diet that's impacted gut function and doesn't even give us the nutrients we need. Tobacco and alcohol, of course. Many medications get in the way of the gut working well and absorption and health of that inner lining of the gut. Imbalances of that microbiome, like we talked about earlier. If we are not eating an adequate amount of fibers, vegetation, if we've had to have long-standing bouts of using corticosteroids or antibiotics, these things are for protracted stress is just unrelenting. These things get in the way of the balance of the good bacteria in the gut and create a problem with our microbiome. And there are other reasons. Food sensitivities, which of course we're going to talk a little bit about today in the testing of that. If we are eating foods that may even be healthy, but they may prompt an immune response for you, and this is not an allergy. If someone has an allergy to a food, it's a different component of the immune system. And for the most part, people will know when they have a food allergy. Not always, but for the most part, you eat something and shortly thereafter, it could be gastrointestinal distress, it could be a headache, it could be something itching, your eczema that you occasionally get ramps up, a hive or scratchy throat. These are pretty much clear indicators, and the timing of them is relative to when you ate that food. You eat it again, you start to figure it out without any lab testing, but sometimes it's not that clear. But rest assured, is a different component of the immune system that handles a food allergy than one that handles the food sensitivities. Food sensitivities, on the other hand, are handled again by different part of the immune system, and typically they don't create those more immediate or very short-acting reactions in the body that you can equate or put one and one together to and figure it out for yourself. A lot of times they're food that you're consistently eating and like to eat, and they drive immune responses underneath that can create more distant problems in the body, more systemic problems in the body that you don't believe are coming from your food, because it's not that one-on-one relationship that we see with food allergies. Food sensitivities can create inflammation in the gut, and that impedes absorption of nutrients. Okay? So a list of some micronutrient absorption influencers. Why do micronutrients matter? So right here, I put together a slide that shows different aspects of our physiology and our metabolism and some of the key vitamins, nutrients, micronutrients, minerals that are involved. And there are others. We just threw one or two or three of the specific micronutrients up in the category that's shown there on the left. If you see the number 3 and 4, microbiome, that's a microbiome, its diversity and its richness, many different vitamins, and there are others that are important for that. immune function, vitamin A, vitamin D. Going through COVID, we learned about certainly vitamin D. Vitamin A was a big player that was unfortunately not talked about nearly as much as we needed it to. But you can see here, they matter. We have to consume them. We have to consume foods that have them, not should have them, but actually don't because of harvesting and shelf life and transit time and how you cook them and so forth. These things should be cooked generally lightly or eaten raw. These fibrous vegetation. Some can't handle the fiber when it's raw, but lightly cooked. But to support immune function, digestion, and so forth, we need micronutrients. Okay. As well with food sensitivities, they generally develop over a period of time. They can irritate the intestinal lining called the endothelial lining, which can disrupt the barrier between the lumen of your GI tract and getting into the body. So when you so we understand, when you eat some food, we should chew thoroughly, start to create digestive process efficiently, get down, and there should be enzymes and an acidic environment that allows for breakdown of the proteins and the carbohydrates and the fats and so forth. And those enzymes will work on it even further, breaking down to their simplest components. And then they get absorbed actively through the endothelial lining of the gastrointestinal or GI tract. When we're consuming foods that we have immune reactivity to, and there's different reasons why that can occur, things don't happen as efficiently as I just mentioned. We can start getting irritation or even inflammation in that area, and this starts to restrict the absorption of micronutrients. Listed there are the common food sensitivities, close to an order of their prevalence as well, I might add. Okay, wheat, gluten, dairy, eggs, corn, soy, yeast, citrus, nightshades, legumes, and nuts. If you see there, wheat and gluten are separate because not all of the peptides of wheat are gluten. There's probably about 25% or so of the peptides of wheat that are non-gluten, and these peptides are used as fillers and as other things in prepared and processed food stuff. So we have to be careful. If we have sensitivity to wheat and the food stuff says it's gluten-free, it doesn't mean that all the peptides of wheat are out of it. So there's more than meets the eye a lot to these things, and which is why we do this testing. But in and of itself, we have to be careful and have it be in concert with a provider, a clinician that is versed and has experience in interpreting it, listening to a person, and getting insight into their specific problems, and putting that together to come up with therapeutic strategies. Because it may not just be, well, I'll eat a little bit more of these 3 nutrients that it says I'm short on. What are the reasons why it's, why we're deficient in those micronutrients? Sometimes it is simply a matter of taking them. But unfortunately, many times it's more involved in that. So I have 1 or 2 testimonials, more testimonials here, but this one I liked. This is, she certainly was kind enough to share her full name. What I liked about this is, well, she talked a little bit about the nature of the center, but on the bottom, she talked about all the different things and that well, not specifically, but that there are many different things, and there's education, and that she is not just in less pain, but she is healthier and stronger. And in NMR, we're very clear on that. Someone comes in and they are dealing with, let's say, back pain, but we also see they're 40 pounds overweight. We know that they're inflamed, their diet's not right. We want their back to feel better, but we also want to make sure that back gets stronger. And we also definitely want to make sure, to the best of our abilities through educating and so forth, that the patient understands the other aspects of their lifestyle that are contributing to this problem, most potentially to some other health problems, by being inflamed and not caring or minding to those other aspects of that triad of health. So getting into aspects of testing, who can benefit from the micronutrient and food sensitivity testing? So there are different conditions. If you look on the bottom left, chronic disease, autoimmune disorders for sure. A lot of times skin problems come up, eczema and psoriatic problems come up, a weakened immune system, certainly digestive issues. And for those who are more proactive, athletes, someone trying to become pregnant wants to have their body in the best shape possible. We actually do a fair amount of that, which I'm happy about. Sometimes restricted diets are listed being vegan or vegetarian. They come with a positive side, but a potential downside. We have to make sure that we're looking at all the different nutrients, micro and macronutrients, that they're being satisfied. But then in the upper left, sometimes what I want to stress here is that we have symptoms that so many people have that we think it's normal, and maybe it's commonplace, but it's certainly not good. And I wouldn't want to consider it normal, where we're tired, our energy's low, we have not such a great outlook, a little bit depressed, our immune system's down, we catch more things than we should that are quote unquote going around, we're always stressed. I would say that the bundle that we created here for this presentation, looking at food sensitivities and micronutrient status in your body, is a great place to start to see where some of those insufficiencies and deficiencies are, and where we're creating immune reactivity just with the foods that we eat that we would have no idea. Okay? Because it's important to understand, sometimes people will get a test back and they are sensitive to certain fruits or different things. Say, well, I don't even eat that much. Or I don't feel anything when I eat that. That may be the case. You may not eat that much because of food sensitivities. It's about immune reactivity, but not necessarily creating symptoms like an allergy would. Okay. Potentially, if you're sensitive to a food and you eat an abundance of that over time, you will start to create an inflammatory burden that will probably show up as symptoms. But sometimes the symptoms show up very vague. My energy is just low, chronically fatigued, I have brain fog. These things are all indications that there's an inflammatory process and immune reactivity going on that isn't a disease. So a regular doc looking at regular blood work is not going to pick it up. And if I had a nickel for every patient that came in not feeling well with some of these things in the upper left, had blood work and the doctor said everything's fine, and they walk out of there still having all those symptoms, if I had a nickel, could have retired by now. So please understand that. The power of support and precision health testing. We want early and precise diagnosis. We all certainly want to find things early. That's the way to go. The longer we wait, defer, ignore things that are going on with our health, generally, the harder it is to do something about it. And the neat thing about early diagnosis and early intervention is it's usually conservative, it's usually lifestyle based, and we don't have to get into medical procedures and medications when it's early on. Most people don't want to do those things, yet they don't take the initial step of making sure that doesn't happen. They just maybe wish it doesn't happen, and that doesn't work. But we combine that with holistic health and wellness. What does holistic mean? It's nothing quirky or way out there. It just means we, instead of being ultra specialized and looking at just a certain aspect of the kidney function, and that's what that physician does, we take a step back and try to look at the entire picture and what are the processes, what are the mechanisms that are being utilized by the body to get better or to create dysfunction and disease. Identify those mechanisms, and then what is we can do to test and do something about that with personalized care and ongoing support. And this almost always shows out to have better better health outcomes for the person. So advanced functional lab testing, okay, which is what we're talking about with these two tests. And there are others, by the way, we can test your micronutrient status and find out there's a host of micronutrients you're deficient in and decide we have to dig deeper. We can't just give you all those different vitamins. Why is that happening if it's so many of them? Or you're sensitive to a lot of different proteins or foods when we do the hypersensitivity. Well, in that case, if there's so many foods, a lot of times it has to do with digestive function. And it has a lot to do with the intestinal barrier. Has that been breached? Is there problems in that area? Is the microbiome really in dismay? And we have to handle that. So the clinical correlation to this testing is very important. But in doing the testing that's more progressive and forward thinking, we identify root causes of your health concerns earlier, faster/earlier. It helps reduce the risk of misdiagnosis and unnecessarily treatments. It's also very common for me to sit in front of a patient, because a lot of times they go to the regular doctor first and they go through testing, and they go through sometimes multiple rounds of the same testing before they get to me. And as much as maybe a little bit of that was valuable to make sure there's nothing, very bad going on, usually nothing was found. And those, particularly the redos on those tests were unnecessary. I have a patient right now, already had an MRI with some brain symptoms going back months and months ago. She came to me the other day and she said, well, I just went to the neurologist. They want to do another MRI. Well, the first one was absolutely clean. Nothing's happened since. There's no reason. It's just that's their go-to. That's what they have left. And it's not going to show up anything again. So sometimes things are unnecessary. Sometimes it's nice to get them out of the way and realize, okay, there's nothing bad. I can continue with a lifestyle intervention with some of these specialized tests. Okay. But we can spot potential diseases. Sometimes the laboratory testing we do can find out about diseases or dysfunctions in the making. And then you can be more proactive in your lifestyle approach, whether that's genetic testing or other specialized lab testing to kind of head things off of the path, so to speak. Gain a full picture of her overall health compared to standardized lab tests, like we said. It's very common. People don't feel well. They don't have a specific disease. The regular blood test comes back completely normal, but their overall health clearly isn't good. There's other things we can look at and look deeper into them and usually have some answers, sometimes a lot of the answers, but usually there's other work that can be done and things that can be uncovered and dealt with. You see personalized treatment plans based on your unique needs rather than broad symptoms. I will also encourage y'all to be very careful of just basing things on symptomatology. It's very common that most diseases start out for weeks, months, years, or more without symptoms, meaning something you can feel or sense, but the imbalance, okay, and the biochemistry and the inflammation in the body is occurring, and we can see these things earlier on if they are pursued and investigated intelligently by a clinician. I put this up here because the neat thing about the micronutrient panel is all of the different micronutrients that you have insufficiency or deficiency in. Oh, and by the way, just to be clear on the testing itself, if you went to your doctor and you said, I think I'm deficient in, well, let's take vitamin B12. They'll typically just look at what's in the serum, the fluid in your blood. And that's a snapshot of that moment in time, what your B12 status is. Not valuable, but it's very limited in what we can do with that because it's transient, quite transient. The micronutrient panel is looking at the serum, but as well, and maybe more importantly, looking at the white cell blood membrane, okay, white blood cell membrane, to see the status of that nutrient within it, and gives us a picture that lasts from days to weeks and more in regards to how you're doing with the nutrient status of that particular micronutrient. Okay, and there's a couple on the panel that look at the red blood cell membrane as well. The one I love is the omega index. We test that a lot on our patients. If the red blood cell membrane is showing a poor status of the fatty acid profile, number one, we got to see why that's occurring. It could be just from a gastrointestinal or a consumption insufficiency, and we can correct that. But we definitely know that if the cell membrane is poor in its nutritional or fatty acid status, it's going to be something that gets in the way of absorbing the micronutrients into the cell. So we want to look at that. But back to this slide, everything that you would have as an insufficiency or a deficiency on the panel gives you this great information, what it's important for, okay, the function, how it gets depleted, okay, what happens, the manifestations of that depletion, where you can find it in food, and then some supplement options that you may have and different considerations there. So I mean, it's very thorough in the reporting and the information educationally that you would receive to help you out, as well as obviously talking with the physician or the clinician about it. Okay, how do we do the test? This is a blood test. I don't know if I was clear on that, but this is a blood test. And the way to do that today is, or actually sign up for today, if you will, is you scan on the bottom right there, and it'll put you into our WellPros store, and you'll see this bundle of tests along with the consult that comes with me. And those are done in person, and we're doing 10% off if you purchase that between now and I think it's February 6th. There'll also be a link in the chat. If you're not scanning, if you're listening on your phone, you can get that link and do the same thing. Get into the WellPro shop of ours and order up the test. Once you order that test, we'll be sending out an email. That email will give instructions on setting up your phlebotomy and other things that are associated with it, give instructions, and you'll also have access to a phone number to talk to a live person about the steps you can take, okay? So moving forward, you can do things like, you can still try to figure it out on your own. Some people do, and some people do it with success. Usually it's because there were just a couple nutrients missing. They did a little research, they tried them, everything else physiologically was working well, and they hit the nail on the head. They caught lightning in a bottle, and a lot of stuff cleared up for them. And that's great. That's great. Saves everybody, costs, time, and so forth. But for a lot of people, they run around in circles, and multiple doctors. Unfortunately, I see way too much of that without many good answers. As opposed to, investing in yourself, getting some accurate information from some more specialized tests that look a little deeper into some of these mechanisms of dysfunction and disease. Okay, give a clear, personalized plan for yourself, and of course the support, which is very important. With more of my complex cases, patients that have a lot more involvement, there's a lot more intake and workup with them. But one of the things that we do is I for a little bit of time, I want a weekly follow-up email and I have questions that they are answering each time, just to make sure. Accountability is important with this. Lifestyle sometimes is not easy for people to change, so we want to be with you on that and help you make the changes consistently for yourself till you're at a point with your lifestyle and those habits where you don't want to undo them. You can't undo them. If you undo them and stop doing them for a day or a few days, you don't feel right, and you get back to it. That's our hope. Okay. One more testimonial. Kirsten came in with a bunch of autoimmune problems. Took the time to hear my story, made a personalized plan for me, and for the extra $50 I gave her, she added that the plan has been working, so that's cool. Anyway, you can go. You can go on our Google reviews, and I think you'll find dozens and dozens and dozens of people sharing, positive experiences, and we're certainly happy about that, and fortunate that that's the case. Okay, so today we talked about the micronutrients, who can benefit from that testing, as well as the sensitivity, the role, how food sensitivities can impair that nutrient absorption, and the testing itself. Moving forward, I guess the question is, are you ready to invest in yourself and take advantage of the offer with the discount that we have, and start getting yourself into a better mode of health through your lifestyle, with specialized testing specific to you and consultation and follow-up that helps you on that journey. Okay, I want to thank you guys, those of you who are on board, for being there and being attentive to it. I certainly hope, the hope is with all lectures that I do that at least something comes out of it for you that you can take to heart and put into action and have it impact you or family members or friends' health in a positive way. I'll leave it now to Lisa, who introduced me. There may be some questions on the chat that I can help out with.
Okay. Yep. Thanks, everybody. I just want to let you know, if you have questions, you can go ahead and put them in the chat, and not everyone will be able to see them, but I will be able to see them and I will read them to Dr. Sferra. So I'm just going to open up the chat now and see what's in there. So, okay, there's one here that says, my husband has had chronic fatigue for years. Can you help him?
Okay, so chronic fatigue can be simply I'm tired, or it can be a result of prior viral infections where those viruses harbor and remain dormant in the body and are always challenging the immune system. So there may be more specific testing than even the ones that we talked about today. But certainly chronic fatigue is something I don't know if 2 patients in a row come in without having chronic fatigue as part of their problem when they're dealing with functional medicine doctor. It goes hand in hand. And the reason is one of the most important things that our cells do is create energy. And if there's dysfunction there, usually that's one of the first things that goes. So as we learned today, micronutrient status is important. Immune reactivity will also create fatigue and deplete energy and ability of the body to create energy. So maybe a place to start, but we may be looking at other things. We may be just looking at a bunch of questionnaires that can, and along with a consultation, to really start to investigate what may be going on with your husband. I mean, I'm assuming he's been to other doctors and he's not anemic, and he doesn't have hypoglycemia, but maybe not. But certainly that's something we on a daily basis are working with our patients on.
Okay, so there's another question in the chat, and it says, how long is the offer good for? So that's going to be good until the 6th, February 6th. And there is another question. How long does it take to get the lab results back?
So this is specialized lab work. This isn't looking at your blood count where they get it while you're sitting in the waiting room. I hope you can appreciate that. So usually it's a 2-week turnaround. Sometimes it's earlier, but we don't like scheduling our consultation for review of the lab report and so forth for 2 weeks after the blood draw itself.
Okay, and then there's a question in there that I can answer. It says, does the cost include the visit? And yes, it does include the review consultation. Another question is, someone has a daughter who is 16 and they want to know if this is appropriate for teenagers.
100%. I would venture to say that the sooner the better. If you can get a nutritional status and foods that an adolescent or a teen is reactive to, my goodness, we could be saving years and decades of them creating inflammation, eating foods that are creating a host of other problems, creating deficiencies, or like I said, insufficiencies that are at the foundation of things that they are dealing with, hormonal imbalances, energy, could be some autoimmunity that can occur very early on, fatigue in teenagers and so forth. We can get on top of it and stop it instead of them having 20, 30 years of that before, a disease sets in. So absolutely.
Okay, and then someone else is asking or saying that they suffer from arthritis and they want to know if this is helpful for people with arthritis.
Okay, so with any condition, we, as a functional medicine provider, I'm looking again to find out the mechanisms as to why that occurs. There are many different types of arthritides, and not just a couple of them are immune related, okay, or autoimmune in nature. And for those in particular, this testing and possibly others would directly apply, and unfortunately are not done in conventional medicine. You have to pursue these outside of that kind of system to see why in the world is my immune system attacking my joints. Typically in conventional medicine, they see that it is happening and then they give medicines, corticosteroids, immunosuppressive drugs, pain meds to help alleviate the pain and the inflammation at the target tissue, which is the joint. But it is not investigated why the immune system is doing that. And that's not always, but that's a good chunk of the time. That's what's going on. So we would want to know why the immune system is doing that. Now, for other types of arthritis, like just an osteoarthritis, a football player had too many whacks to the knee and now they're 45 years old and it's starting to creep up on them. Yes, nutritional status is very important because what? Well, the food that you eat becomes you. Remember, you are what you eat, think, and do. But in this case, you are what you eat. And if we're not providing the raw materials, if we're not providing the foods and the essential fats that reduce inflammation, we can be antagonizing that degenerative change that has occurred there from the old injury or so forth. So without any question, these are integral parts of really working a person up comprehensively and seeing everything we can do to manage their condition and have them be as functional as possible.
Great. Okay, there's another question that wants to know, how long is that review consultation with you?
It's an hour. I have to admit that sometimes I take a little longer. I hope people appreciate that and realize I'm trying to educate, but it's scheduled for an hour. Sometimes it goes a little longer depending, questions and things like that. I try to save a little extra time so that best I can, everything's answered appropriately, but it's an hour schedule.
Great. All right, so there are a couple more questions in the chat, but we're kind of running out of time now. And I just wanted to let you know that we will be sending out an email to you. And in that email, you can reply to that. That'll be my direct email that you can ask your questions. If we didn't get to them, just email them to me and we'll try to get back to you. That's my direct line on the screen right now. You can call me if you have any questions. And we just want to thank you so much for joining us today, and look for that email. And we look forward to seeing you again real soon. Thanks so much.
Thanks, y'all. Best of health to you.